Madam Chair, members of the committee, for the record, Dr. Vern Saboe, representing the Oregon Chiropractic Association. I want to speak to Oregon's provider non-discrimination law, which was passed in 2015, which was to, in part, protect alternative medical providers from discrimination by commercial health insurers and health plans. My take-home message is that the law continues to be violated by some insurers and health plans, and the insurance division is not enforcing. And we believe a lot of this has to do with confusion regarding legislative intent and meaning of the terms, and this has to do with several missteps that occurred early on, which I'll get into in just a moment. As per the legislative intent and meaning of these terms, the statute states that an insurer may not discriminate with respect to participation under a health benefit plan or coverage under the plan against any healthcare provider who is acting within the scope of the provider's license or certification under this state. Not to discriminate as far as participation means that they must allow some chiropractors, some acupuncture, some naturopaths onto their panels. They cannot say, well, we're just not going to let any of you scallywag chiropractors on the panel. We don't like you. We don't want you. They must allow some, and it must be an adequate network, adequate number of providers. Coverage means that not to discriminate as far as coverage means if it's a covered health benefit or medical service that's within a scope of license of a healthcare provider, chiropractor to provide, and we provide it, they must reimburse us for it. So they can't say, well, you may be licensed, the scope of your license may allow you to do that procedure, but by and large we don't pay chiropractors for that, or naturopaths, or licensed acupuncturists. The next section is this subsection does not require an insurer to contract with any healthcare provider who is willing to abide by the insurer's terms, conditions, participation established by the insurer. This is simply saying this is not an any willing provider law. An any willing provider law is such that in states that have that, if a provider states that by contract they're willing to follow the rules and the guidelines of the insurer or health plan, they must allow that provider on panel. This is not that, but you must have some on panel. This is important later on where I show you where some flawed guidance came out from the federal government that further confused the issue. Further, this subsection does not prevent an insurer from establishing varying reimbursement rates based on quality and performance measures. The point of this language was insurance payment parity. The only variance from which insurers and health plans can vary reimbursement rates is based on outcomes, quality and performance measures, meaning that out of the gate they cannot pay a chiropractor less than an osteopath for the same covered service. However, if I do a better job or the osteopathic physician does a better job, we can be paid more and or get an end of the year bonus. That was the legislative intent of that language, which has never changed dating back to 2010, and I'll get into that in just a moment. To further validate the legislative intent, this language was the product of a work group which drafted and became House Bill 2468. It was a work group convened by the insurance commissioner at the time, Laura Calley. There were 14 insurer representatives and 3 alternative medical providers on this work group. I represented the chiropractors. Dr. Jeff Clark represented the naturopaths, and Steve Conforey represented the acupuncturists and doctors of Oriental medicine. This is a legislative council opinion written by Lori Freeman, wherein when the bill was in front of the House Health Committee, then State Representative Newt Buehler asked Ms. Calley, what does it mean to discriminate against a healthcare provider? Ms. Calley answered, and I quote, an insurer cannot discriminate based on the type of licensure that a provider has and say, well, you may be licensed to do a certain procedure or the scope of your license allows you to do that, but as a general rule, and she uses us as an example, I'm not going to reimburse a chiropractor who performs that service. She goes on to say that insurers cannot say that the insurer does not contract ever with any chiropractors, or the insurer will not reimburse chiropractors for this. So she touches upon the coverage piece and the participation piece. She does not broach the issue of varying reimbursement based on quality and performance measures, but I'll get into that in just a minute. This law was, this language came from the Accountable Care Act. And the legislative intent and meaning has changed. When the Accountable Care Act, Obamacare, was moved through Congress and was headed to the Senate side, we formed a large coalition of alternative medical providers and other providers, and went to then Senator Tom Harkin, Iowa, now retired, who is a strong advocate of alternative medical providers and treats with my good friend, Dr. Dal Bates. And we said to Senator Harkin, I said, we're fundamentally going to change how we change healthcare in this country and how we pay for, how we deliver healthcare, not just how we pay for it. Insurers and health plans simply cannot be allowed to discriminate against healthcare providers, especially alternative medical providers. He agreed, and he drafted what became known as the Harkin Amendment. It passed Congress and became Section 2706 of the federal law. That's where the language came from. Now, where the confusion started, we believe, is back in 2011, 2012, when the Oregon Health Authority convened what was known as the Essential Health Benefits Work Group. Every state, by federal mandate...
I have about 5 minutes now left.
So every state was required to come up with a benchmark plan. They selected Pacific Source Co-Deduct Plan, and here's where the wheels came off. This predated the Accountable Care Act and the Provider Non-Discrimination language. And as you can see here, it says chiropractic not covered, optional rider. Naturopath, not covered, optional rider. And if you look above chiropractic, it's not highlighted. It's acupuncture, not covered, optional rider. That on its face would be in violation of federal law. It was clear that the work group simply did not know these non-discrimination provisions existed. How could they? It was a 1,100-page bill. This was one small paragraph, and it became very clear that they didn't know. And their comments in their final report to Governor Kitzhaber, who strongly supported the non-discrimination provisions, it was noted that while they state alternative medicine, it was noted that while these particular benefits have a potential to result in long-term savings for health plans, the work group focused on the intermediate premium impacts, and the plans offering these benefits were considered too costly for many Oregonians. Health insurers may still offer blah, blah, blah. Clearly, they had no idea would be in violation of federal law, but that law would not go into effect for 2 years, January 1 of 2014. Further confusing the issue was the federal agency Center for Consumer Information and Insurance Oversight, CCIO, under CMS, produced flawed guidance that went to all 50 states, and this really threw a monkey wrench into the machinery. Cut to the chase, the language that flips the legislative intent and meaning of the terms on its head. This provision does not require plans or issuers to accept all types of providers. Well, that would allow them insurers and health plans to not contract with any chiropractors if they chose not to, or naturopaths, or licensed acupuncture, which would be in direct violation of the federal law and congressional intent. They go on to state this provision also does not govern provider reimbursement rates, which may be subject to quality performance, and then they add language, which an agency cannot do to statute, or market standards or considerations. There was 1,500 responses around the country to this. Congressional response. DCBS duplicated this guidance, which also clouded the issue. Then Congress, the Appropriations Committee, U.S. Senate, and Senator Harkins chaired, admonishes CCIO and this guidance in their calendar report 128 on July 11th, 2013, 3 months later. And the goal just basically goes into the goal of this provision is to ensure that the non-discrimination provisions, patients have a right to access covered health services from the full range of providers licensed and certified in their state. The committee is therefore concerned about the FAQ document it issued and on April 29, 2013, that advises insurers this non-discrimination provision allows them to exclude from participation whole categories of providers operating under state license or certification. In addition, the FAQ advises insurers that the Section 2706 allows discrimination in reimbursement. Rates based on broad market considerations rather than the more limited exception cited in law for performance and quality measures.
You have
Section
a minute
2706, what's that?
A minute to sum up.
Section 2706 was intended to prohibit exactly these types of discrimination. The same language is in the CCO bill, the CCO law. Governor Kitzhaber, we went to him in 2012. The CCOs are also under the obligation to follow this non-discrimination language. It's the same language. The CCOs are following it pretty well. And so we're going to come back in 2021, and we're going to come back with clarifying language that will absolutely clarify the legislative intent and validate the legislative intent and meaning of these provisions. So hopefully they can finally be enforced. Madam Chair, that completes my testimony.
Thank you very much. You held to your 15 minutes, like I said. All right. Questions? No. All right. Thank you very much, Dr. Saboe, Tom Holt, and Trina McClure-Gwaltney.
There we go. Chairman Anderson, members of the committee, for the record, I'm Tom Holt here on behalf of the Oregon Community Foundation today, and with me is Trina McClure-Gwaltney from the Mercy Foundation in Roseburg, who you'll be hearing from in a couple of minutes. We're here today to provide you with an overview of work that we've been continuing with many stakeholders that this committee and the House committee have been involved in for several years of focus on oral health and improving it for kids in our state. You may recall that a few years ago, we passed a bill that created the dental director position within the Oregon Health Authority, and it's an important part of that work. Our role at OCF has been to be a convener of stakeholders, educators, providers, payers, and organizations that represent the populations served by programs that go into schools to provide oral health services, primarily basic screenings and delivery of molar sealants and fluoride varnishes, all by parental permission, and then connecting kids to dentists when they need one. And you will see here in a minute that it is quite common that they need one. Oops. Can I get this too? There we go. Just a very high level view, a couple of stats slides here for you just to set some context. Oregon's kids, according to the SMILE survey that the Oregon Health Authority does every 5 years, 2017 is the most recent, do not have great oral health. About half of our kids have or have had cavities. About 1 in 5 are untreated, and about 1 in 20